I'm Dr. John Wycoff, the founder and CEO of the Wycoff Wellness Center, and I want to introduce you to intravenous or IV chelation. Intravenous chelation is a simple and safe office procedure that involves administration of a chelating agent such as EDTA, ethyl diamine tetraacetic acid, into a vein. IV chelation reverses or slows progression of atherosclerotic heart disease or hardening of the arteries and other age-related degenerative diseases. IV chelation may also be used to remove heavy metals in adults or children with problems that include autism spectrum disorder, ADD, ADHD, or Tourette's syndrome. The process of intravenous chelation begins with an appropriately trained physician and staff. I have received extensive training in the chelation process through the American College for the Advancement of Medicine, completing a certification course and examination. The Wycoff Wellness Center staff has received extensive training in the appropriate administration of IV chelating infusions to allow for a safe and pleasant experience. The first step in the process is for you to be evaluated by me. This initial visit allows me to obtain and review a detailed history and perform an appropriate physical examination. We will review any diagnostic testing you may have had done, such as blood tests, cardiac stress testing, arterial blood flow studies, or angiography tests. We would then decide together if some form of chelation would be appropriate for your specific health issues. The next step is to ensure that you have adequate kidney function to tolerate the stress chelation may place on your renal system. Chelation allows toxic metals to be bound in such a way as they can be eliminated from your body primarily through urine via the kidneys. Most patients will tolerate this process without any concern, but it is important to evaluate your kidney function before beginning a course of chelation. This can be easily accomplished by obtaining simple urine and blood tests. We may ask you to have specific tests obtained before beginning chelation so we can monitor your progress throughout your treatment. My office will coordinate the needed testing for you. We may follow specific tests during your treatment to evaluate your specific progress. Intravenous chelation is a safe and effective alternative to cardiac bypass surgery, angioplasty, or cardiac stent placement. It may be used after a heart attack or stroke, or as a therapy to prevent these terrible issues from happening in the first place. It may be used as a treatment for dementia and cerebral vascular disease. It is very helpful for peripheral vascular diseases that can limit your ability to walk or exercise. Chelation may help improve blood pressure and reduce your dependence upon prescription medications. IV chelation may be used for patients with chronic fatigue, fibromyalgia, cancer, or autoimmune illnesses. Chelation is a powerful tool in the treatment of autism spectrum disorders. IV chelation can be used as a way to detoxify and improve circulation in an effort to improve general health and wellness. Many patients elect to have a periodic infusion in an attempt to just keep their plumbing cleaned out. You see, chelation is much akin to placing some type of chemical to dissolve the buildup in your home's plumbing. You can think of chelation like a roto-rooter of the arteries in your body. Chelation removes the toxic metals that are causing buildup in your body and allows them to be safely removed from the body. It is an easy, safe, and well-tolerated procedure. We also find that new blood flow is established in patients receiving chelation in areas that did not previously exist. These IV infusions are performed in our infusion room by our trained infusion specialist, who will accompany you through the entire process and ensure your comfort while you're reclining in a recliner. You're welcome to bring a book to read or a headset to listen to some pleasing music. All we need is access to one forearm for the venous infusion. Our IV specialist will obtain venous access in a vein at your elbow. This is no more than a small needle prick similar to having a blood sample drawn. The infusion will begin and take typically 90 minutes for most cardiovascular infusions. You may get up, walk to the restroom if you need during the infusion. We often perform intravenous push infusions for specific indications such as autism spectrum disorders, ADHD, ADD, and other issues. These infusions take only 10 to 15 minutes. We will assess your progress with specific testing throughout your course of therapy. It is important that you take a quality multivitamin and mineral supplement while receiving IV chelation. We will recommend other natural treatments and lifestyle changes as part of your treatment program. This might include a specific vitamin and mineral supplement, exercise program, or eating program. These are all important parts of a comprehensive pathway to improving your health and wellness naturally. The Wycoff Wellness Center is Mid-Michigan's expert in intravenous infusion therapy. We perform these infusions each and every day. Find out if intravenous chelation may be of help to you. Take time to browse our website for additional information. We are committed to improving your health and wellness naturally. Thank you for taking the time to view this informational video. The Wycoff Wellness Center. Our results can change your life.